Today's remote jobs are all mid to upper entry level non-clinical healthcare jobs. I have 5 opportunities for you and most of them are brand spanking new. Let's scan through them. So the first one I have comes to us from Forefront Dermatology. This one is for a clinical schedule coordinator, patient access. This job is full-time remote anywhere within the United States. No location restrictions anywhere on this job description. And you work Monday through Friday, 10 a.m. to 6:30 p.m. Central Time Zone hours, but you don't have to live in the Central Time Zone. Just translate your local hours to those hours. So this is the kind of job I know a lot of you are looking for. In this position, you'll offer collaboration and subject matter expertise with crediting, updating, and managing clinician schedules and preferences. And you do that to ensure accuracy and efficiency for patient appointments using patient access department best practices. So in other words, you'll assist with creating, updating, and or distributing clinician schedules and templates. You'll maintain practice management databases and be responsible for the professional preferences portal, entering in new clinics and clinicians and ensuring it's accurate and up to date. And they tell us you must attend mandatory meetings, which include but are not limited to onboarding and acquisition, customer service, department, and staff meetings. And for this job, you need a high school diploma or equivalent. They prefer, but they don't require. They prefer you have a bachelor's degree in business administration, healthcare administration, or a related field. And they want you to have 1 to 3 years practice management system experience. They highly recommend you have data analyst experience and you're able to demonstrate leadership by serving as an example to others. You're proficient using Microsoft Word products, and then you have your typical soft skills you need for just about every job. And as far as the salary, they tell us right here on the job description, they'll pay you $23.45 up to $23.95 per hour. So our next opportunity comes to us from Interwell Health. This job is for an enrollment coordinator. It's full-time remote anywhere within the United States. And in this position, you'll be responsible for enrolling eligible health plan members into the CKD program. You'll make calls to eligible payer program members to discuss the benefits that the CKD program can provide them in an effort to persuade them to join the program. You'll partner cross-functionally with various operational business units while supporting departmental objectives within company and regulatory guidelines. So that pretty much sums up what you're going to do on a regular basis. They have a little bit more details. If you're interested, go ahead and read through the details. You work Monday through Friday, 10 a.m. to 6:30 p.m. Central Time Zone hours. You don't have to live in the Central Time Zone. Translate your local hours to those hours. And they want you to have about 2 years experience in patient support, customer service, call center, or sales. You can meet all performance goals. You have excellent phone presence, including active listening and clear verbal communication. You have a high school diploma or a GED. You also have a positive, compassionate, and tenacious professional approach. And I'm scrolling around to see if they tell us how much they pay, and I don't see it anywhere on this job description, nor did I see it on the application. But based on my experience looking at similar roles, I'm willing to bet this job will pay anywhere from $20 to $26 per hour. But there's no way I can guarantee that's how much you'll make in this particular role. You'll have to work out your salary with them. Talkiatry has an opening for a licensing specialist to work full-time remotely anywhere within the United States, no location restrictions, and what you do is consult clinicians to obtain current credentialing information and or supporting documents to ensure data is current and accurate prior to licensing application submission to avoid processing delays. You're really comfortable using Microsoft Office applications, Adobe Acrobat, and web-based research, and you have knowledge of all state and federal initial and renewal licensing requirements and processes for all clinical positions. They want you to have 2 years experience with physician group and or hospital credentialing. You have a high school diploma or a GED, and a bachelor's degree is a plus. You have knowledge of certification requirements, regulations, company credentialing policy and procedures, and state and federal regulations, and you can perform all required primary source verifications per NCQA guidelines. And you're also able to investigate and analyze information. And scrolling down a little further, they tell us they'll pay you anywhere from $24 to $26 per hour. Another brand new job I have is with the Doctors Company, also known as TDC Group. This job is for an underwriting operations analyst. It's full-time remote anywhere within the United States. And what you're going to do in this position is support employee training projects, customer service improvements, and continuous advancements for best imaginable service within the Department of National Underwriting. So what all that means is you'll do some processing and support. You'll ensure all processing activities are accurately completed in accordance with policies, procedures, rules, and and regulations, and they have a little bit more details as far as what that entails. You also do some internal and external customer collaboration and support, and that's pretty self-explanatory. You do some continuous improvement and customer service support, providing process recommendations to management to continuously improve and support the implementation of new workflows. You also do some project management and personal development, working with managers to identify and achieve annual and personal development goals. So we can see here they tell us they'll pay you between $52,937 and $69,480 per year, and what they want from you in this position is a high school diploma or equivalent and about 3 years administrative work of increasing responsibility. It's strongly preferred but not required. Strongly preferred you have experience in insurance, healthcare, or customer experience, and you can read and interpret documents such as safety rules, operating and maintenance instructions, and procedure manuals. You also have strong technical writing abilities. You're able to speak effectively before groups of customers or employees of the organization. You have basic math skills. You're a problem solver. You can type 50 to 55 words per minute accurately, and you're comfortable using all Microsoft Office programs. You can use Excel and PowerPoint to create graphs, diagrams, and charts. Our last remote healthcare job is also brand spanking new. This one comes to us from MIDI Health. This job is for a clinical support representative. It's full-time remote anywhere within the United States. And this looks like your typical customer support kind of position with a few other things mixed in. You'll perform patient communication and support, serving as a primary contact for inbound patient calls routed through PSRs and or AI phone tree routing. You also do some clinical coordination. That includes reviewing patient charts in the EHR to understand order, prescription, and referral status. And you'll also document all patient interactions, requests, and follow-ups, and route clinical tasks to medical assistants, RNs, or providers. You also participate in workflow and compliance quality, which means you'll follow standardized workflows to determine when to resolve, route, or escalate inquiries while maintaining strict adherence to HIPAA and PHI handling requirements. And last but not least, you'll do some collaboration, partnering closely with patient service representatives, medical assistants, RNs, and practice administration leadership while servicing recurring patient issues, bottlenecks, or workflow gaps to leadership. So in this job, you will not provide medical advice or clinical interpretation, nor will you modify treatment plans, prescriptions, or orders. They want you to have about 2 years' experience in a healthcare contact center, medical office, or clinical operations environment. You have experience working with EHR systems. They strongly prefer that is with Athena Health, and you have a strong understanding of outpatient healthcare workflows. They'd like you to have a medical assistant background or equivalent outpatient clinical experience. You're comfortable using Zendesk or similar contact center platforms. You also have telehealth or virtual care experience, and then you need your typical soft skills. And scrolling down a little bit further, they tell us they'll pay you $23 per hour. So that does it for the jobs I have for you in this video. Hopefully one of these remote healthcare jobs works out for you. And if you're looking for more opportunities, you can find some in this video right here. But if these jobs are a little too advanced, you want some very entry-level healthcare jobs, you can find some on my other channel, Cat Lewis. So have a great day. Take care, and I'll catch you on the next one.